Today's topic is anatomy of nose and paranasal sinuses. Points to be covered in today's topic are embryology of the nose, that is the development of nose, external nose, internal nose, which constitutes of lateral wall of the nose, septum or medial wall of the nose, roof of the nose, and floor of the nose. We will also study nerve supply, blood supply, and lymphatic drainage of the nose. There are four major paranasal sinuses, that is the maxillary sinus, frontal sinus, ethmoid group of sinuses, which constitute of anterior and posterior ethmoid, and sphenoid sinus. We will also study mucosal drainage, that is the mucociliary clearance of these paranasal sinuses, nerve supply and blood supply of paranasal sinuses. So nasal cavity and paranasal sinuses are completely lined by respiratory ciliated columnar epithelium or the mucosa of the nose, which helps to warm, moisten and filter the air that we breathe in. And nose begins anteriorly from the external nares and extends posteriorly up to choana, where it opens into. There is a midline septum which divides the nose into two narrow nasal cavities. These nasal cavities are laterally bounded by three shelf-like bones, also known as turbinates. Lateral to these turbinates, underlying the turbinates, are three meatuses, into which the four paranasal sinuses, that is the maxillary, frontal, ethmoid, and sphenoid, drain into. This is the diagrammatic representation of our nose and paranasal sinuses. In midline, the pointer shows the septum, lateral to which are two narrow nasal cavities. There are three shelf-like bones, inferior turbinate, middle turbinate, and superior turbinate. Lateral to these turbinates are spaces called meatuses, respectively known as inferior meatus, middle meatus, and superior meatus. There are pneumatized portion of the bones known as paranasal sinuses, known as maxillary sinus, frontal sinus, anterior and posterior group of ethmoid sinus, and most posteriorly there is a sphenoid sinus. So when we look at the nose, external appearance shows root of the nose, which is the articulation of the frontal bone, that is the nasal process of the frontal bone with the nasal bones. Below the root of the nose is the bridge of the nose. The entire extent of the front of the nose is the nasal dorsum. There is the external projection, which is tip of the nose. Just above the tip is the supratip of the nose. From the tip of the nose up to the philtrum is the columella, and the philtrum connects the columella of the nose to the upper lip. This entire external nose is formed by an osseo-cartilaginous framework. Upper one-third is osseous, that is the bony framework, and lower two-third is the cartilaginous framework. This bony framework is formed by nasal bones, nasal process of frontal bones, and frontal process of maxilla. Together, they form the pyriform aperture at which these cartilaginous structures are attached. The cartilaginous framework is formed by the nasal septal cartilage, which is in the midline, upper lateral cartilage, lower lateral cartilage, also known as alar cartilage, and there are few accessory cartilage, mainly 2 or 3 in number, also known as accessory or lesser alar cartilage. So anatomy of nose can be broadly divided for study purpose into external and internal nose. In external nose, we will study osseo-cartilaginous framework, muscles of the nose, which will help in facial expressions, and skin overlying the nose. Internal nose will constitute lateral wall of the nose, vestibule, septum, which is also the medial wall of the nose, osteomeatal complex, floor of the nose, and roof of the nose. Starting from development of the nose or embryology of the nose. So in formation of the nose, The cells are derived from the neural crest cells, which form the nasal pit. They enlarge to form the nasal plecoid. These nasal plecoids enlarge to form medial and lateral nasal prominence. There is maxillary process and the mandibular process. Lateral and superior to this nasal plecoid is the lens plecoid, which forms the orbit. So at 5 weeks, we can differentiate the medial nasal process, which is the yellow portion, and lateral nasal process or prominence, which is the blue portion. Orange portion shows the maxillary prominence. These gradually converge and form the nasal cavity, that is the septum, lateral wall of the nose, floor of the nose, and roof of the nose. Floor of the nose is mainly formed by fusion of the maxillary process and the lateral process of the lateral prominence of the nasal process. This will help in forming the hard palate. Any deviation from this fusion leads to cleft lip, cleft palate, and fistula between the nose and the oral cavity. So external nose has cosmetic value. It enhances the personality and beauty of the person. First thing to be covered is the osteocartilaginous framework of the nose. Upper 1/3 is the bony, which is formed by the nasal bones and frontal process of the maxilla and nasal process of frontal bones. Lower 2/3 is the cartilaginous framework formed by the upper lateral cartilage, lower lateral cartilage or the alar cartilage, and the septum cartilage, which helps in forming the dorsum of the nose. Various surgical procedures to enhance the beauty of the nose are termed as rhinoplasty or septorhinoplasty. So when there is overcorrection or any traumatic event, it leads to the loss of the dorsum, that is the septal cartilage of the nose, and mostly it happens in submucous resection surgical procedure. This leads to supratip depression of the nose. This is the diagrammatic representation of the osteocartilaginous framework. As you can see, the nasal bone, the frontal process of the maxilla. This is the entire maxillary bone. It fuses in midline. This is the nasal process of the frontal bone. So laterally there are orbits. This entire bony framework forms the pyriform aperture of the nose. There is the upper lateral cartilage. In midline, that is the septal cartilage, which forms the dorsum of the nose. Lower lateral cartilage, and these are accessory alar cartilages. The soft tissue just lateral to the lower lateral cartilages is devoid of any cartilaginous tissue and has only soft tissue framework. This forms the soft angle of the nose. This is the basal view of the external nose. It shows in midline the septum. Laterally there are lower lateral cartilages. There is the medial crus, dome, and the lateral crus. This is the ala of the nose and tip of the nose. This septal cartilage fits into the nasal crest, which is formed by the maxillary bone, also known as the anterior nasal crest or maxillary crest. The maxillary crest fuses anteriorly to form the anterior nasal spine. So the nasal musculature is formed by 4 main muscles: procerus, nasalis. There are 2 parts of nasalis, alar part and transverse part, levator labii superioris aliquinesi, and depressor septi. These muscles of the nose help in facial expression. Now skin over the nose is thin and freely mobile over the nasal bone as well as the upper lateral cartilages, but it is thick and adherent over the alar cartilages. Hence, any furuncle in this region is painful. Now what is rhinophyma? It is a condition of hypertrophy of the sebaceous glands of the skin of external nose, which gives a bad cosmetic appearance. Now the entire triangular region from the nasion to the angles of the mouth, which includes the external nares and the upper lip, is known as the danger area or the danger triangle of the face. This region is dangerous because any furuncle or abscess or infection in this region can easily travel via the inferior ophthalmic vein to the angular vein to the cavernous sinus, as these are valveless veins that drain into the cavernous sinuses. Now, internal nose. There are four main parts of internal nose, that is the lateral wall, medial wall or the septum, roof and floor of the nose. Starting from lateral wall of the nose. Main components of lateral wall of the nose are vestibule, atrium, bones of the nose, that is nasal bone, frontal process of the maxilla, lacrimal bone, turbinates, inferior, middle and superior turbinate, palatine bone, that is the perpendicular plate of palatine bone, and sphenoid bone, that is the medial pterygoid plate portion of the sphenoid bone. There are three meatuses, inferior, middle and superior meatus, and there is the sphenoethmoidal recess. This shows the skeletal framework of the lateral wall of the nose, the nasal bone, nasal process of frontal bone, frontal process of maxilla, the ethmoid bone, which constitutes the superior and middle turbinate. Inferior turbinate is a separate bone. Lateral nasal cartilage, that is the upper lateral cartilage, and the lower lateral cartilage, which is the alar cartilage. There is the perpendicular plate of palatine bone. Horizontal plate forms the floor of the nose, and floor of the maxilla or the palatine process of the maxilla forms the floor of the nose. This shows the frontal sinus and posteriorly the sphenoid sinus. Sphenoid sinus formed by the sphenoid bone, and the depression over the sphenoid sinus known as sella turcica lodges the pituitary gland. Now, starting from vestibule of the nose, it is the antero-inferior portion of the nasal cavity which is lined by the squamous epithelium, which contains the skin with sebaceous gland with hair follicles and vibrissae. Hence, it is bound to get infected and form a furuncle. This infection in this region is known as vestibulitis, and it is a very painful condition since this region lies in the danger area of the face. The infection can easily travel intracranially into the cavernous sinus. Lymen nasi is the area of constriction in the respiratory tract, which is formed at the junction of upper lateral cartilages and lower lateral cartilages. It can be visualized on elevating the tip of the nose. The boundaries of the vestibule of the nose will be: floor is formed by the anterior portion of the floor of the nose. Superiorly and laterally, there is the caudal margin or the inferior margin of the upper lateral cartilage. And medially, there is columella and lower portion of the septum up to the mucocutaneous junction. Now, atrium. Atrium is a roomy region. It is also known as the atrium of the middle meatus. It is above and slightly posterior to the vestibule. This region is the vestibule and this region is the atrium of the nose. It is immediately anterior to the middle meatus. Hence, it is slightly anterior and superior to the middle turbinate. Its lateral wall is concave and it is close to the nasal bone, where there is a slight elevation. This elevation is because of the agar nasi, which is the anterior-most pneumatized anterior ethmoid or pneumatization of the anterior ethmoid. Now, the three shelf-like bones of the lateral nasal wall are superior turbinate, middle turbinate, and inferior turbinate. Superior and middle turbinate are formed by parts of ethmoid bone, whereas inferior turbinate is a separate bone. Now inferior turbinate, it is a separate bone. It is longer. It is almost along the entire length of the floor of the nose. As you can see here, from almost behind the vestibule up to the choana. It is midway between floor and middle turbinate. This is the floor of the nose and the middle turbinate. It lies midway. Eustachian tube opening in the nasopharynx lies 1 cm posterior to the posterior end of the inferior turbinate. Now, while performing the functional endoscopic sinus surgery, during the manipulation of the middle turbinate, if this turbinate is manipulated more violently, then it may lead to fracture of the superior attachment of the turbinate, which may lead to fracture of cribriform plate, because cribriform plate is a thin bone. This leads to CSF rhinorrhea. The cerebrospinal fluid will flow through the nose and come out as clear nasal discharge. There are also few variations of the middle turbinate, namely paradoxical middle turbinate and concabulosa. In paradoxical middle turbinate, the middle turbinate will be curved in opposite direction, and hence the lateral surface of the middle turbinate will be convex. When the entire middle turbinate is pneumatized and it forms a large bulbous structure, causes nasal obstruction, it is known as concabulosa, and it is seen in 30% of normal population. Lateral to the middle turbinate is the middle meatus and the osteomeatal complex. So now osteomeatal complex is a complex structure constituted by various structures of the lateral wall of nose, and it forms integral part of the mucociliary clearance. It is formed by uncinate, middle turbinate, bulla ethmoidalis and infundibulum, that is the ethmoid infundibulum. Frontal sinus, maxillary sinus and anterior ethmoid sinus drain here. Its surgical importance is in performing surgeries like functional endoscopic sinus surgery, whose main aim is to achieve the clearance of this osteomeatal complex and create a normal functional drainage pathway. Also, it is important in performing limited middle meatus enterostomy. This diagram shows the osteomeatal complex. This is the midline septum. This is inferior turbinate. This is middle turbinate. This is the orbit and maxillary sinus. From superior border of the inferior turbinate, there is attachment of the uncinate process. Medial to the uncinate process is the middle turbinate. Laterally, there is ethmoid infundibulum. All these structures constitute the osteomeatal complex. Slightly posteriorly, this pneumatized portion is also known as bulla ethmoidalis. Now superior turbinate, it is also a part of ethmoid bone. Sometimes there is also a supreme turbinate, which is even smaller turbinate posterior to this superior turbinate. Superior turbinate is in the posterior superior part of the nasal cavity. It is very short, and the space posterior to it is the sphenoethmoidal recess, where the sphenoid sinus opens into. Superior meatus is a narrow fissure between the middle and superior turbinate, and the posterior ethmoidal cells open into its anterosuperior part. Surgical importance of superior turbinate is in reaching the sphenoid sinus. We may need to outfracture the superior turbinate in the intermediate approach of the sphenoid sinus. The other approaches are through the posterior ethmoidal cells and in midline directly towards the sphenoid ostium. This shows the diagrammatic representation of inferior turbinate and meatus, middle turbinate and middle meatus, superior turbinate and superior meatus. Posteriorly is the space sphenoethmoidal recess. This is the sphenoid sinus. The sphenoid ostium opens here. This is the frontal sinus. Now bulla ethmoidalis. This is the most constant ethmoidal air cell located posterior to the uncinate process and helps in forming the osteomeatal complex. It is also the middle ethmoidal air cell. It is anterior to the ground lamella. All the cells anterior to the ground lamella are anterior ethmoidal cells, and all the cells posterior to the ground lamella are posterior ethmoidal cells. Ground lamella is also the second attachment of middle turbinate, where the middle turbinate attaches to the lamina papyracea. It is also known as basal lamella. The bulla ethmoidalis may extend superiorly up to the skull base and posteriorly up to the ground lamella. If this extension is not complete superiorly, it leaves a suprabullar space, and if it is not complete posteriorly, it leaves a retrobullar space. If both the spaces are left behind, then it forms a complete lateral sinus of Grunwald when both of these spaces are present. Now there is one variation of bulla ethmoidalis where in 1% of the normal population it is non-pneumatized. Surgical importance of bulla ethmoidalis is to take care of the vulnerability of the anterior ethmoidal artery which runs in the roof of the nose. Other structures in the lateral wall of nose are hiatus semilunaris, uncinate process, ethmoid infundibulum, and agar nasi. Now starting from hiatus semilunaris, it is a two-dimensional space or gap between the posterior superior free border of the uncinate, and posteriorly there is the anterior surface of bulla ethmoidalis. It opens laterally into the three-dimensional space of ethmoid infundibulum. Uncinate process. Now uncinate process is a part of the ethmoid bone. It has two borders and two ends. Posteriorly it is attached to the upper border of the inferior turbinate. Anteriorly and superiorly there are variations in the attachments. Three main variations are to lamina papyracea, to skull base, and to middle turbinate. Now this diagrammatic representation shows nasal septum, cribriform plate, the lateral lamina of cribriform, medial and lateral lamella of cribriform plate, fovea ethmoidalis. This is the orbit. The medial wall of orbit is lamina papyracea. This is the maxillary sinus, inferior turbinate, middle turbinate, and floor of the nose. So when the uncinate process, which begins from the upper border of the inferior turbinate and it is attached to the lamina papyracea, is the most common variation. Superiorly it is attached to the part of the cribriform plate, the lateral lamella. This is the second most common variation, and third is attached to the middle turbinate. Very rarely this superior attachment may be a free border of the uncinate. Now ethmoid infundibulum is a three-dimensional space lateral to the hiatus semilunaris into which all the three anterior group of sinuses, that is the frontal sinus, anterior ethmoid sinus, and the maxillary sinus open. Boundaries of the ethmoidal infundibulum are posteriorly there is the anterior face of the bulla, anteriorly there is lacrimal bone, and superiorly there is the frontal recess. Now agar nasi, as we studied before, this is the anterior most pneumatization of the anterior ethmoidal cell, and it lies as a bulge over the atrium, nerve supply of the lateral wall of the nose. There is the anterior ethmoidal nerve, which is a branch of ophthalmic division of the trigeminal nerve. It supplies the anterior part of the lateral nasal wall. Posteriorly, there is the maxillary nerve, and via the pterygopalatine ganglion, it gives various branches to the mucosal glands and the mucosal epithelium of the nose. The low terminal branches of the maxillary nerve, that is the greater and lesser palatine nerve, they pierce through the greater palatine canal and enter the roof of the mouth or the floor of the nose. There is an internal nasal branch of the infraorbital nerve, which is also a branch of the maxillary nerve. And superiormost in the region of the olfactory epithelium, there is a supply of the olfactory nerves and olfactory bulb. The other parts of the internal nose are medial wall or the nasal septum, roof of the nose and floor of the nose. Nasal septum will be covered separately. Roof of the nose is formed by anterior sloping part, which is the nasal bones, middle horizontal part, which is the cribriform bones, and posterior sloping part, which is the body of the sphenoid. Floor forms the hard palate of the mouth, which is formed by the palatine process of maxilla and the horizontal process of palatine bones. Now let's study about nasal septum. There are three main parts of the nasal septum: columellar septum, membranous nasal septum, and septum proper. Entire nasal septum is covered with mucosal epithelium. Beneath this mucosal epithelium is mucoperichondrium and mucoperiosteal layer. The layer overlying the cartilaginous region is mucoperichondrial, and the layer overlying the bony region of the nasal septum is mucoperiosteal layer. The columellar septum, it is covered on both the sides with skin, and it consists medial crura of the lower lateral cartilage or the alar cartilage. The membranous septum is devoid of any cartilage, and it is only formed by double layer of the skin. The septum proper consists of osteocartilaginous framework, which is covered by mucoperichondrial and mucoperiosteal layer, over which it is completely covered with the mucous membrane. Bony framework of this septum will be the perpendicular plate of ethmoid, vomer bone, and the rostrum of sphenoid. And the cartilaginous framework will be quadrilateral septal cartilage, which is attached to the perpendicular plate of ethmoid and the vomer bone. Importance of nasal septum is that it divides the nose into two narrow nasal cavities, and it gives structural support to the nose and forms the dorsum of the nose. Any variation in this osteocartilaginous septal framework will cause septal deformities. They may be bony or cartilaginous. When there is deviation towards one or both sides, it is known as septal deviation, and when there is a sharp deviation with the bony spicule projecting, it is known as a spur. When there is a cartilaginous deviation to one or both sides, it is septal deviation, and when the septal cartilage is dislocated from its anterior attachment in the nasal crest, it is known as caudal dislocation or caudal deviation of the nasal septum. Usually, the bony deviations will be in the posterior half of the nose, and the cartilaginous deviations will be in the anterior half of the nose. If both deviations are present, then there may be an S-shaped deviations. If only one of the deviation is present, there may be a C-shaped deviation. This shows the skeletal framework of the nasal septum. The perpendicular plate of the ethmoid bone, which is contributed by ethmoid bone. Superiorly there is cribriform plate. This is the vomer bone, and posteriorly this is the rostrum of sphenoid. Anteriorly there is the cartilaginous framework, which is formed by the septal cartilage, or also known as quadrilateral cartilage. This is the alar cartilage, and this is vomerine cartilage, which is also known as vestigial organ. It is responsible for sensation of the pheromones in lower mammals. The floor of the nose is formed by the horizontal plate of palatine bone and palatine process of the maxillary bone. Arteries of the medial wall or the septum, it is supplied by anterior and posterior ethmoidal artery, which are branches of internal carotid artery, sphenopalatine artery, which is a branch of external carotid artery, greater parotid artery, and superior labial artery, which are also branches of external carotid artery. They converge and anastomose with each other to form Little's area or Hasselbalch's area. Innervation of the nasal septum is by the anterior ethmoidal nerve, which is a branch of ophthalmic division of trigeminal nerve. Internal nasal branch of the infraorbital nerve, which is also a branch of maxillary division of trigeminal nerve. Nasopalatine nerve, which is a branch of maxillary division of trigeminal nerve. Mucosal lining of the nose is the skin in the anterior-most region of the vestibule and anterior part of the inferior turbinate. Mucosal epithelium in most part of the nose and paranasal sinuses, and olfactory epithelium in the roof of the nose. So the blood supply of the nose is mainly from two branches of external and internal carotid artery. External carotid artery has main two branches which supply the nose, maxillary and facial artery. From maxillary artery there is sphenopalatine, greater palatine and infraorbital arteries. And from facial artery there is superior labial artery which supplies the upper lip and lower portion of the nose and tip of the nose. Internal carotid artery, which has no branches in the neck, has intracranially branch ophthalmic artery which gives two branches, anterior and posterior ethmoidal artery. This is the diagrammatic representation of our blood supply. In the anteroinferior portion of the septum, the anastomosis between the internal and the external carotid artery is the Little's area or the Hasselbalch's area. This is the most common area for epistaxis in pediatric age group. In those patients, in those children who have constant habit of nasal pricking or recurrent episodes of URTI, which will inflame this region of this nasal mucosa and cause transient bout of epistaxis. So this region of Little's area is anastomosis of four main arteries: anterior ethmoidal, sphenoidal, greater palatine and septal branch of superior labial artery. It is also a site of fibroangioma of the nasal septum. Now there is a submucosal vascular plexus. It resembles the erectile tissue. It consists of arterioles, capillaries, vascular sinusoids, venous plexus and venules. It is present in the deep specialized tissue of the inferior turbinate and the adjacent septum, as well as the posterior part of the middle turbinate. So this is present in submucosal region and it is under the control of the autonomic nervous system. So when sympathetic vasomotor nerves, they will stimulate it, they will cause vasoconstriction, and when the parasympathetic nerves are stimulated, they cause vasodilation and watery nasal discharge. Under condition of the parasympathetic stimulation, there will be nasal obstruction as well. Now when there is any strong irritant smell or chemical irritants are applied to the nose, this submucosal vascular plexus is stimulated and it absorbs this and it may cause apnea and bradycardia. Nerve supply of the nose. There is an nerve supply in the olfactory epithelial region by the olfactory nerves, which is responsible for the smell sensation. Trigeminal nerve carries the common sensation of the touch and irritation. The ophthalmic and maxillary division of the trigeminal nerve are mainly involved. Ophthalmic division will provide anterior and posterior ethmoidal nerves. Maxillary division will provide the infraorbital nerve and branches of the sphenopalatine ganglion, which supply the nasal mucosa and the mucosal glands of nose. Facial nerve, it supplies the lower part of the nose as well as the tip of the nose. Autonomic nervous system, which constitute of the sympathetic as well as parasympathetic component. Parasympathetic is from the sphenopalatine ganglion, that is the greater superficial petrosal nerve, and sympathetic is from thoracic 1 and 2 as well as the deep petrosal nerve, which is from the surrounding the internal carotid artery. Now what is Vidian neurectomy? In some patients with extensive vasomotor rhinitis, it has been observed that with video neurectomy, this symptom can be evaded. This is the diagrammatic representation of a nerve supply, anterior and posterior ethmoidal nerves, nasopalatine nerve, and the external nasal nerve, which is a branch of anterior ethmoidal nerve. Lymphatic drainage of the nose is mainly into the submandibular lymph nodes, retropharyngeal lymph nodes, and upper jugular nodes. Now, anatomy of paranasal sinuses. Paranasal sinuses can be divided into two main groups, anterior and posterior groups. Anterior group will be maxillary, frontal, and anterior ethmoid sinuses, and posterior group will be posterior ethmoid sinus and sphenoid sinus. This shows us paranasal sinuses, the frontal, maxillary, anterior and posterior ethmoid sinus, and the sphenoid sinus. This diagram shows paranasal sinuses in frontal, that is the coronal view, as well as lateral, that is the sagittal view. In coronal view, it is easier to appreciate both maxillary sinus, ethmoid sinus, and the frontal sinus. In lateral view, it is easier to appreciate all the sinuses, that is the frontal, maxillary, anterior ethmoid, posterior ethmoid, and the sphenoid sinus. Starting from maxillary sinus or antrum of Highmore, also known as sinus of Highmore, it is embryologically first to develop. It is the largest sinus. It is pyramidal in shape with its base directed towards the nose and apex towards zygoma. Medially, it forms the lateral wall of the nose. Laterally, it articulates with zygoma. Anterolaterally, it forms the bony wall of the cheek. Posteriorly, it forms the anterior boundary of pterygopalatine and infratemporal fossa. Inferiorly, along with the alveolar process and the palatine process, it forms the roof of the mouth. The maxillary ostium, it opens medially into the lateral wall of nose, into the ethmoidal infundibulum, into the osteomeatal complex. Osteomeatal complex is an integral surgical anatomical part in the functional endoscopic sinus surgery. The pink shaded area shows the position of the maxillary sinus. Note the inferior border or the inferior level of the maxillary sinus is at a level lower than that of the floor of the nose or roof of the mouth. It is at almost same level in children. This lower level is present in adults. The maxillary ostium drains into the osteomeatal complex posteriorly and drains finally into the choana. Relations of the maxilla. The bony wall of the maxilla, bony wall of the orbit. This is the maxillary sinus. In roof of the maxilla, there is infraorbital foramen, which contains infraorbital nerves and vessels. Laterally, it forms the bony wall of the cheek. Inferiorly, there may be elevations formed by the canine teeth. Medially, it forms the osteomeatal complex and lateral wall of the nose. That is, the uncinate process, the maxillary ostium, the ethmoidal infundibulum, ethmoidal bulla, which is the pneumatized anterior ethmoidal cell, middle turbinate, nasal septum. The frontal sinus is above and deep to the supraorbital ridge. It is between the inner and outer tables of the frontal bone, and there is a varying intervening bony septum. The frontal ostium is the narrow constricted portion which opens into the frontal recess, which finally drains into the osteomeatal complex. This blue shaded area is the frontal sinus, and the arrow represents drainage of the frontal sinus into the osteomeatal complex. This is the diagrammatic representation of the frontal sinus, constricted ostium, and the frontal recess, which ultimately forms an hourglass shaped or a funnel shaped structure. Frontal ostium and frontal recess are possible sites of obstruction of the drainage of frontal sinus based on the presence of frontoethmoidal cells as well as agar nasi cell. Ethmoid sinuses. There are two main groups of ethmoid sinuses, anterior and posterior, based on their locations compared with the ground lamella of the middle turbinate. It is also known as the basal lamella of the middle turbinate, and it is the attachment of the second part of the middle turbinate. The cells anterior to the ground lamella are anterior cells. Most constant anterior ethmoidal cell is BULLA ethmoidalis. Most anterior ethmoidal cell is the agar nasi. Agar nasi is also a variable cell. It may not be present in 10 to 20% of the normal population. It is pneumatization which appears as a slight elevation over the atrium, and it lies anterior to the frontal recess. Other variation of the anterior ethmoidal cell is halar cell, which is pneumatization of the roof of the maxilla or the floor of the orbit. The posterior ethmoidal cells are located posterior to the ground lamella. They are larger than anterior cells, fewer in number, pyramidal in shape, with apex directed towards the base skull. One variation of the posterior ethmoidal cell is Onodi cell, which is surgically and clinically important because it is the posterolateral pneumatization of the posterior ethmoidal cells over the sphenoid sinus. Hence, this increases the vulnerability of optic nerve as well as the internal carotid artery while operating in the sphenoid sinus. Other variation of the ethmoid sinus are the frontoethmoidal cells. There are 4 types of frontoethmoidal cells, which is the pneumatization of the ethmoid cell into the frontal sinus. Type 1 is a single frontoethmoidal cell in the frontal recess not crossing the supraorbital ridge. Type 2 is 2 or 3 cells not crossing the frontal recess. Type 3, a single cell pneumatizing the frontal sinus and mimics the opening of the frontal sinus. And type 4 is a loner cell into the frontal sinus. All these cells may obstruct the drainage of the frontal sinus and cause isolated frontal sinusitis. The drainage pathways of the anterior and middle ethmoid are in the osteomeatal complex, and the drainage pathway of the posterior ethmoid is in the superior meatus. This diagram shows representation of the ethmoidal air cells in sagittal and axial views. In sagittal view, this is the base skull formed by the frontal bone, ethmoid bone, and the sphenoid bone. This is the basal lamella or the ground lamella of the middle turbinate. Cells anterior to it are anterior ethmoidal cells, and cells posterior to it are posterior ethmoidal cells. The variation, that is the agar nasi, it can be larger in size and obstructs the drainage of the frontal sinus into the osteomeatal complex. This is the frontobullar cell, suprabullar cell, retrobullar cell. The cells posterior are the posterior ethmoidal cells, sphenoid sinus, inferior turbinate, floor of the nose or hard palate. In the axial view, this is the second attachment of middle turbinate known as basal lamella, uncinate process, ethmoidal bulla. Clearly we can appreciate the osteomeatal complex in this region. The space posterior to ethmoidal bulla is retrobullar space. If there would have been space above it, it would be suprabullar space. Both of these combined will form the lateral wall sinus of Grunwald. Cells posterior to this basal lamella are posterior ethmoidal cells. This is the superior turbinate. This is the sphenoethmoidal recess, and the sphenoid ostium opens into the sphenoethmoidal recess. Sphenoid sinus. It occupies the entire body of the sphenoid with a variable interseptum. The variations of the septum decide the dominance of the side of the sphenoid sinus. Sphenoid ostium, it opens into the sphenoethmoidal recess in the upper part of the anterior wall of the sphenoid bone. Sphenoid sinus and the drainage pathway. The relations of the sphenoid sinus. This is the intervening septum. Roof of the sphenoid may extend up to the sella turcica, which lodges the pituitary, as it can be seen in this diagram. Based on the extent of pneumatization of the sphenoid, it may be of 3 types: conchal, presellar, and sellar. Conchal is very less pneumatized sphenoid sinus. Presellar is when the posterior border of the pneumatization is up to the anterior border of the sella turcica, and sellar is when it extends below the sella turcica. This is a sellar type of sphenoid sinus. Just above and lateral, that is posterolaterally, there are optic nerves and formation of the optic chiasma, which is present in front of the pituitary. They present as an indentation in the sphenoid sinus. Laterally, there are indentations of the internal carotid artery, which is present in the cavernous sinus, which can be appreciated in this diagram. In the lateral wall of cavernous sinus, there is presence of the nerves, cranial nerves 3, 4, 5 and 6, that is oculomotor, trochlear, trigeminal and abducens. Abducens is located more in the substance of the cavernous sinus. Paranasal sinuses are lined by mucosal membrane, which is thinner, less vascular and in continuity with the mucous membrane of the nasal cavity. Ciliated pseudostratified columnar epithelium is present with numerous mucoserous and goblet cells. They produce a mucous blanket. This mucous blanket creates two layers, that is the inner serous sol layer and outer viscous gel or mucus layer. The constant action of the cilia creates a mucociliary clearance pathway which drains out the sinuses into the choana and create a functional nasal and nasal cavity with paranasal sinuses. The lymphatic drainage of the paranasal sinuses is in the upper deep cervical nodes, retropharyngeal nodes and the upper jugular nodes. Blood supply is by both external as well as internal carotid artery. Branches of external carotid artery supplying are facial and maxillary, and the most important is the sphenopalatine branch of the maxillary. Branches of internal carotid artery are ophthalmic, which provides anterior and posterior ethmoidal arteries, which enter from the roof of the nose and supply nose and paranasal sinuses. Nerve supply of the paranasal sinuses is mainly trigeminal. The two divisions of trigeminal are ophthalmic and maxillary. The divisions of ophthalmic supplying are supratrochlear, supraorbital, anterior and posterior ethmoidal. The supratrochlear and supraorbital are branches of frontal branch of ophthalmic, and anterior and posterior ethmoidal are branch of nasociliary part of ophthalmic. The trigeminal maxillary division of the trigeminal nerve gives branches greater palatine, posterolateral nasal, superior nasal and sphenopalatine nerves which supply the paranasal sinus. That finishes the anatomy of our nose and paranasal sinuses. Thank you.